Omega. Beside thee, there is no other God. Alpha, Alpha, Omega. Beside thee, there is no other God. Alpha, Alpha, Omega. Thank you, Jesus. Beside thee, there is no other God. Thank you, Jesus. Thank you, Jesus. Good evening or good afternoon. Welcome to Passion Based Global Training Institute. This is Module 2, Introduction to AI and Data. This is the Unit 9, Digital Technologies, Cloud, Devices and Connectivity. This is especially for, a very good unit for independent healthcare practitioners, just for you to see a lot of business ideas you can have out there, make money from it, and what the connectivity look like. Okay, the devices you will need, how the cloud, how you require the cloud, and how that can help your business. Okay, this is Passion Based Global Training Institute. We are here to empower revivalists, uproot godliness, as well as building legacy. The root out token is the cryptocurrency God has given to us to be able to empower young people as well as older people, in various corners of the world, to be able to, reset our systems and live for Christ. So may God help us in Jesus' name. This is the Digital Business Success Course, Level 3 Diploma. This is the cycle of revival to remind us of the purpose of all these. There are other courses out there in technology. This is different because it's here to empower us to actually live our lives for Christ, and not just that, bring more people to the presence of God. Okay, so what is this all about? Turn your practice into a revenue engine. You can use free tools or even paid tools, smart systems out there, as well as intelligent automation. So what's the learning intention? It's all about being able to see how or understand how the cloud platforms, your smart devices, as well as the connectivity tools, how you can make use of them all to create a scalable income generating healthcare systems, either for yourself or to be able to help other organizations. Okay, and of course you can use free or low cost technology, as well as any AI or machine learning powered automation. Okay, so the success criteria are here. You must be able to at least at the end of this training, you should be able to set up a basic cloud patient dashboard. You might not be able to fully set it up, but at least if you're used to it, you should be able to know what to do. Okay, so select and deploy low cost health monitoring devices and be able to deliver virtual consults, okay, or consultation using free connectivity tools, and then be able to understand and explain how AI automates, personalizes, and optimizes each layer, for each of your clients. And then you probably should be able to set up a 7-day revenue plan for yourself, using at least one of the tools from the category, each categories that mentioned, and then be able to forecast a 12 months return on investments for your business using simple models. Right, okay, so this is the framework we're going to work on. I don't know how that came up, but never mind. So we're talking about the cloud, which is where you store, you automate, and you are able to monetize from there because the data is there. The devices you are able to use to capture, trigger, as well as upsell, because you have you have the information ready. Okay, now I don't know why this is happening. Okay, and the connectivity, you're able to deliver, synchronize, as well as scale. The AI automates. Okay, the AI highlight, sorry, that is disturbing. The AI highlight, sorry, you are able to automate the billing, okay, the consultation summary. You are able to power the chatbots, and of course, or use power chatbots and virtual assistant to support your patient. Also, In terms of machine learning, of course, when you gather the data and put it into the machine, you are able to learn from the data, okay, and then you're able to then detect the trends, predict, the health risk for your patients, as well as improve personalization of your patient's care, as well as and the pricing model. Okay, so let's look into one of them. Google Cloud. Okay, cloud, this is like a cloud revenue engine. You are able to use Google Drive, okay, to host your patient folders. It of course has its own charges. You can also send an invoice using the Wave app. You will see the link at the end of this session. And what is it all about? The AI highlight aspect of it is that you're able to send automated reminder, also receive access alert for your clients. You're able to also manage folders. They are able to manage it also with permission. A billing trigger can be set up as a result of that, of the data in the Google Drive. The machine highlights, you are able to flag machine learning rather you are able to flash missing data entries. Okay, you're able to flag it, you're able to discover it, and then also you're able to predict. Remember, you're getting the data, right? So we're not just operating without nothing, we're operating based on patient. So if you haven't got patient yet, we can't really use this, but you're using the data from your patient. You're able to predict which patients are likely to require follow-up, okay, based on how often they come to you. Okay, electronic health record, cloud billing. This is another thing another app you can use. Notion and Airtable. You are able to track some vitals and symptoms quick rather than having to go through spreadsheet, and that will help you to be able to see 3 extra patients per day. And part of the AI highlights aspect of it, you're able to auto generate visit summary using the billing codes. Okay, and the billing codes using the data that you have. Okay, and then once you're able to track and auto generate, you are able to then suggest what's going to be the next step based on the symptoms that keep developing when your patients visit you. The machine learning highlights your data. Based on the data you learn from historical records, okay, and then you are able to predict deterioration risk. And then appointment can be optimized based on the patient's flow. Okay, this is another one, the legal cloud resale, like healthcare twist. You are able to help your peers. Okay, when I say your peers, I'm talking about other healthcare professionals like you. Can help them to set up different softwares, just using Zoho CRM as an example. Client, you charge this is you if you are more into the IT aspect. You charge them can be up to like $199 per month, depending on which one you're using. And what is that used for? Is to help your people, your peers, okay, your colleagues, not in your place of work, but of course independent practitioners like you. Help them with onboarding new users, automating CRM workflow, helping them to set up usage tips, as well as training reminder. And in terms of the machine learning highlights, with the data they collect, you can support them to understand that they can analyze user behavior so that they can recommend upgrades for them. And you as the owner or the seller can also recommend an upgrade for them. And you're also able to predict which practitioners are likely to churn or require support. Okay, so you can also set up a device product line. For instance, you can buy blood pressure smartwatches on AliExpress or Alibaba. You can monitor even with Google Fit or Apple Health or any other out there. Don't forget, I'm just using all these ones because they are very easy to remember. And what's the AI highlights there? From those devices, alerts can be sent when there is any vital cross or from the threshold, and then the device setup can be automated, okay, and synchronized with your system. And what is the machine learning highlights there? The data you collect can also be used to learn the baseline of each patient, as well as detect any anomalies, and then predict if there's any wear and tear or any failure based on the usage. Now, auto billing workflow, Zapier can be used for auto billing. You can connect it. You can connect Sheets to Wave as well, of course, for the billing. You can automate your invoice after each visit. And in terms of AI highlights, with the auto billing workflow, billing events are triggered and automations. So instead of you having to do it by yourself, one by one, which clients came in today, which one is coming tomorrow. Follow-ups can also be automated, okay, using the automated email part of it, as well as payment reminder. If you've used PayPal before, you'll notice that some of these things, this access is on PayPal as well. In terms of the machine learning highlights, with the data you have, okay, that you'll be collecting, you're able to predict the cash flow based on historical billing, like, like, okay, this is how much is likely to come in this month, so I can do this and that. And any missing charges, any inconsistencies, you can see that this is what they're using to get some information about, what we do sometimes, or maybe if you miss payments. Otherwise, you can imagine a local authority with loads of people. How many people do they want to be monitoring? Without even when they're using spreadsheets a lot. Connectivity premium, you can offer also consultancy, for instance, via WhatsApp, because WhatsApp too is really doing well now, or via Zoom or free conference call. You can charge for priority access, okay, and you can even use I think they're still there. Oh, I'm gonna try and remember the name now. Okay, if I remember it, it will come up again. So in terms of the AI highlights, you can, when you're on there, you can transcribe. Okay, you can transcribe what is being said and just generate summaries. And of course, you are able to manage the virtual waiting room and session timing. Isn't that good? So we don't have to be going up and down for some. The only thing is you can't touch the person. Maybe you want to check their eyes, or or their legs, you can't touch it. But at least if it's something that is just maybe general requirements, you can easily see them online. And but the workflow after, you have there is an app. I'm gonna try and remember the app. Everything that's been said, it just generates everything for you, and then summaries can be generated from there, giving you enough information to work on. Okay, then so the data you collect from there, you can use it if you pass it on to machine learning and the site. You can understand from past consultations, okay, and you're able to personalize what sessions you're gonna run for that patient next time, okay. And of course, the bandwidth and video quality, it can be predicted, it can be supported. With the machine learning, you are able to work on that as well. Okay, 5G global consults, you can partner with overseas clinics, maybe via LinkedIn. Okay, you can use Zoom Pro or Google Meet or free conference call, for instance, and then you are able to support them in get more information from others, okay, about how to support one another. AI highlights, in terms of AI highlights, you're going to be meeting with different people, so languages can be translated, scheduling can be automated, okay, follow-up summaries and prescriptions as well can be worked on using AI. You don't really have to be doing that with spreadsheet. Then in terms of machine learning highlights, okay, you're able to then match patients with ideal specialists based on your case history, predicts consultation duration and complexity based on the past data. Okay, based on past data. So that means we need data. Okay, this is another opportunity. Daily cash stack. You can do a virtual consultation, say for $150 or pounds, auto claim. Okay, in terms of faster payouts. Excuse me. So what then happens is this AI, in terms of AI, it sends invoices and it tracks payments right away, and then you're able to automate your daily revenue reports. Okay, so once the money comes in, you are able to use AI to automate it. And then in terms of machine learning, you are able to forecast income based on all the services you've been rendering, and then if there are any payment trend or delays, you are able to also identify it. So cloud cost versus your profit. If you're on premises, maybe you are spending a lot of money, okay, whereas on cloud probably just 18,000. This, I mean, we don't have the exact data, but that's what it's going to look like, isn't it? Then AI then recommends the cost saving actions for you. Just give me a few minutes, please. Okay, sorry about that. We're not getting back here. But get something. Okay, so going back to the previous slide. So machine learning highlights, this is where you look into the return on investment for your project based on usage and patient volume, all done in the corner of your home. You are also able to predict future savings from your cloud migration. Oh, apologies. Okay, so in terms of security, because with all this you need security for patients data. Okay, you can use different ways, different ways to secure patient data, as long as you ensure that it is well. So you have to do a lot of research, okay, so that you'll be able to know which one is right. So don't look at the ones that just give it a try. If it doesn't work for you, fine, but you can design the badge. For instance, in Canva, you are able to monitor access and block unauthorized users if you engage AI, and then any alert for suspicious activities can be discovered as well. Machine learning highlights any unusual access patterns can be discovered using, of course, when you engage with security software, and then any breach risk you are able to discover, and security upgrades will be recommended to you, whereas you can also do the same for your peers. So scaling your practice, you can track your hours in the Airtable or Notion. Okay, and for the AI aspect of it, you can automate time tracking and billing, and you can send reminder for any unbilled hours. You can also analyze time used to optimize billing, optimize your scheduling, and then any burnout or any inefficiency in your work practice, you are able to discover once, because you've got the data, you get it, data. Okay, it can also make use of a lease model, like in this case now Pixis or Pixis lease model. So you can decide you want to lease devices to clinic and then monitor it via Google Sheet again. Okay, any usage report and maintenance alert. AI can help you even to automate release renewal and billing. AI can help you to do that. Also, any device wear and replacement timeline, machine learning can help you with that, because you've got data, and then you can just use the data, you can check it with the machine learning and be able to gather much more information. Ooh, excuse me. And then it also learns from the usage pattern so that it can optimize the leasing terms. So here are like various business opportunities for you as an independent healthcare practitioner. Okay, let's look into the wearable subscriptions. For instance, you can just buy 100 wearables, and then you can coach people via WhatsApp or Telegram or any other sites. Yeah, send them like personalized health nudges and reminders, automate coaching messages, and from there you are able to learn user behavior, because don't forget, when you're doing all that, you save the input the data to understand the people, your patients, and what you're working on, and then you're able to adapt coaching plans based on that. So because once you see one person maybe a couple of times, you are able to predict machine learning would help you to predict what's likely to happen with the others, and then any dropout risk and any adjustment or engagement strategies can be looked into. Okay, so in terms of CFO as a service, CFO as a service, which is very interesting. CFO as a service is simply I'm trying to remember the name now. Yeah. Oh dear. Okay, I remember again now. But they call it like CFOs, something like that. CFOAAS, CFO as a service. I don't know why but basically what is all about is more about professional financial management. Okay, also strategic support in terms of like budgeting, forecasting, risk management, any financial reporting. Okay, all provided, to chief financial officer, sorry. Okay, you can just do all this because it can be done through an outsourced expert. So you can use Zero or Weave apps. You can of course you can give in terms of how much you get paid for that. And when you do that, the AI can help you to categorize the expenses, automate reports, send alerts for budget overruns. Okay, with the machine highlights, you are able to forecast revenue and flag any financial risk, and then learn seasonal trends while also adjusting your pricing. So there are a lot of ways you can make money as an independent healthcare practitioners. This is only some of them that we've mentioned. Okay, I just want you to have that understanding. Okay, in terms of speed, volume, and volume. Okay, 1 second please. 1 second please. Okay, so we're looking at speed equals volume. Okay, we're talking about speed equals volume because that's basically what AI, machine learning, that's what it's all about. This speed matter. getting to fly, do a lot more, okay, with little efforts. So you can use your mobile hotspot or community Wi-Fi. You can also automate intake with Google Forms. Okay, you can sort forms and send alerts with AI, automate intakes and triage. You can also prioritize urgent cases based on symptom patterns, because you've got data, and the machine learning has helped you to discover what they are, and then you can prioritize it. And you can also predict daily adjustments, staffing, or any throughput staffing using AI and machine learning. So in terms of connectivity, there can be rural connectivity as well. So you can work together as a team, or maybe have a shared broadband, okay, offer remote consultation, set up, manage the bandwidth, schedule consultations, send alerts if there are any connectivity issues. You can also, share the broadband if that opportunity is available. And for machine learning highlights, you are able to then, based on the data again, predict connectivity failure and adjust any delivery, learn usage patterns, because this will help you to optimize service delivery. So in terms of the risks and the savings, you can use Google Drive, Dropbox, Proton Drive, okay, and then I'm just checking quickly, sorry. AI highlights, you can monitor backup, health, you can send alerts. This is using AI, automate any insurance documentation or any other documentation. For in terms of the machine learning, able to predict risk exposure, okay, as well as savings on your insurance. You are able to learn from past incidents, especially with the data, and then you're able to improve any further prevention. I must say that this is one very important aspect that we have to make sure that it's in order, because you really don't want to get into that. It's just too much stress. It can be costly as well. So revenue checklists, we've looked into this aspect, like cloud billing, live device upsell can be launched. We can do a 5G premium price. Remember when we talked about LinkedIn connectivity, like with other people all over the world. A secure badge can be added, just to make sure that your patient's information are not going to different unexpected places. Also, in terms of the AI highlight or aspect of it, you're able to then track checklists, automate tasks, in terms of the progress. Okay, you can send reminders if any item is incomplete. Then in terms of machine learning, you're able to estimate revenue impact for each item, and then learn which aspect of the business drive the most growth for you. So here is a 7-day launch plan for you. I think there are 2 of them, and then there's a 30-day launch plan. Day 1, you can choose to activate your Google Drive, try to migrate one patient folder, and then choose your invoice via Wave apps. You don't have to use these specific ones. Okay, so I'll probably get you some information in terms of the alternatives. Okay, so let's say alternatives to expensive apps. Okay, alternatives to expensive apps. It might not be on this one. Okay, this is I think this is likely to be an ebook. Okay, then you can choose like day 7, this is what I want to do. And don't forget, with the AI, You are able to send reminder, track your milestone, onboarding automated. Okay, and that's for machine learning as well. And the same thing with regards to tracking your implementation and income potential. I'm thinking this happened twice. Oh, no, no, no. This is another plan, 7-day launch plan. Okay, this is for you to start small and earn fast. It's the same process, but it's just an activity. Okay, of which I don't really like the idea, so I might be removing it. 12-month return on investment. This is your goal. You're able to then forecast your income for the first year. Okay, you can, you have a technology model. Your year one cloud resale. Remember when we talked about resale, like let's say 50K, all the devices that you purchased and all the connectivities involved, together with the premium services you provided. Okay, and of course you've been able to automate your reporting. You've been able to track your performances, any missed target or milestone. You're able to track it, and through the machine learning, you are able to then learn any monthly trends, refine your strategy, your pricing model, improving on it if required. Okay, so this is just a reminder for you again. Like, look, this is how you can make profit, save some money. When I say save money, I'm talking about, instead of maybe having to have a big shop, add 5 patients, make more money. Even though there are other factors to put in place, don't forget you have to do your advert, etc. But this is about after it's all sorted. Okay, so now I said, I think there's I don't know. Okay, I see what it's trying to do. So this is like a 1-day launch plan for us. Start small again, earn fast, your Google Drive, your invoice, migrate patient folder. In terms of your first payment, try send reminder and track milestones. Learn from launch data. Don't forget, data is needed for all this. Without data, we really can't do anything, because it's the data we are going to use to predict. Okay, we're going to predict how people visit you, what their requirements are as a patient. Okay, so maybe with one client folder, we may be able to make like $600 or more per year. Okay, and here is also like a 12-month return on investment forecast. Okay, even with some of the free tools, all these are just a reminder for us. This is for a 12 month as well, a 12-month requirement. So this then brings us to the 30-day play, 30-day activity. Just try and take action with one clear and simple move. All your plans, put them in a notebook. Okay, or maybe your Notion or Airtable or Google document, Google Drive or documentation, and then really you choose which one you want to use, who's going to be your first patient, and how much will I charge. Give it a try for 30 days. So for instance, you can sell a wearable to Mr. Ade. Okay, they pay $99 upfront, and then they pay $19 per month for remote blood pressure monitoring via WhatsApp. Okay, so you're going to be able to use Google Drive to store any vital information and then invoice monthly. So Of course, we know what AI and machine learning can do there, because the data you receive from there you can use to improve future offers even for others. So you don't really need a full clinic or platform to start. In terms of this, one device, one folder, one client, $600 per year. Can be more than that, but that's just example. So this is the wrap up. This is the wrap up. Okay, so prepare to scale. Don't forget, these aspects can be used to connect and bring your businesses together: the cloud, the devices. Okay, of course, with the devices you're then able to use your AI, and you are able to engage with machine learning to give you more information, to predict more about your clients, about your billing. And once you've done that, you have built an engine, a money making engine. So you need to grow one system, one patient, move forward. So here are the sites that I mentioned earlier. As you can see, in terms of cloud tools, these are some of the use cases I've mentioned. There's Notion AI, that's for note taking. CRM, you can use those CRM via Zia AI. Proton Drive, you can use Dropbox for backup and synchronization. For monitoring, for the device and monitoring, don't forget like Google Fit and all that. Wearable coaching. Okay, AI wearable coaching. Those are like various ones. Don't forget, there are loads out there. Connectivity and telehealth mentioned in slides 8 to 10 and 17 to 18. Okay, you can use Zoom as AI companion. WhatsApp business, I'm sure AI is already coming up on that. Jitsi Meet, okay, and encrypted video calls can be made. Suki AI, okay, it's like an AI assistant for doctors. AI chatbot for triage, as well as satellite internet for rural clinics, which is the Starlink. Okay, there are many others out there. Like I said, you don't have to use this one. Billing and finance, as mentioned in those other slides above. Free invoicing, workflow automation, Zapier, AI accounting, Zero, and financial forecasting. Don't forget your Google Sheets, plus the machine learning add-on, especially with the teachable with Google. And I believe this might be the last one. Return on investment tracking can be done on your Google Sheet. You can track the time using Clockify, and then Salesforce Health or any other one can be used. There's an agent force in Salesforce. And we got another one, forecasting and optimization. Okay, yeah, I think this is still the same thing. What happened? Like it's doubling. Okay, and this is the final one. Come on, let's go. Claim a Google business profile. Add your services, your photos. Ask people for your review. Always not forget that. Measure your calls and page speed. Don't forget, we mentioned that in the previous one. And then you can get like a free 1 hour coaching as to what to do. And that brings us to the end of this very model. Oh, thank God for that. Now I need to quickly find out which one was like a repeat, or did that just fly in? Fly in, fly out. All right, okay, it's not a repeat, it's just the same thing. Okay, so make good use of it. And here we are done. Thank you for listening. God bless you. Have a wonderful afternoon.